doing cesarean section, which we do a lot, with the baby coming out, and suddenly the whole room turns into a roar of laughter, and you drop the drape, the mother sees the baby, the dad does skin to skin. I think it just gives you that instant joy. And that's, delivering babies is one of the professions where that gratification is instantaneous.
Mm-hmm. Welcome to the Specialty Cafe, the podcast that helps you, medical trainees, find your perfect specialty. My name is Cameron Wong, and I'm a current fourth-year medical student at Queen's University. I'm joined here by Dr. Modupe Tunde-Byass, an obstetrician gynecologist at the University of Toronto. Thanks so much for joining me on this podcast episode, Dr. Tunde-Byass.
Thank you, Cameron. I'm so excited to be here today.
Do you think you'd be able to tell the audience a bit more about yourself?
So, like Cameron has introduced me, I'm Modupe Tunde-Byass. I'm an associate professor of obstetrics and gynecology at the University of Toronto. I'm also on staff at North York General Hospital for the last 25 years or so. So I do a lot of work. I'm the inaugural president of Black Physicians of Canada and the president-elect of Federation of Medical Women Council. My work, apart from being a generalist, also involves research, medical education, passionate about EDI, and early pregnancy complications and maternal mortality in Black women.
You have a lot of different hats that you wear.
Looks like I had a big head.
So much to cover in terms of your job as an obstetrician gynecologist, but then also in your many leadership roles as well. I want to make sure that I can cover as much as possible. I'll start with talking about your hats as an obstetrician gynecologist. Do you think we could start with just the basics of what does an obstetrician gynecologist do?
So as you can tell that I'm so passionate about talking about obstetrics and gynecology, which is a specialty that actually looks after women. The gynecological aspect also has a lot of operations, has medicine within it, looking after women throughout their reproductive life stage. And then the obstetric part of it is actually delivering the babies and doing things like cesarean section. But within that specialty, there are other things that people may not really see or talk about. So that would be the medical aspect of it, as well as the surgical and the opportunity to do research, teach, and also the leadership that you talked about. So this profession offers everything. That's why I'm in it. It's also, before I forget, it's a 5-year residency program. And in addition to that, you can decide to subspecialize. So you can subspecialize in maternal fetal medicine, which is the medical aspect of it, with some surgery. Otherwise, things like urogynecology, gynecology, oncology, minimal access. So there's so many varieties within that subspecialty. Or you can just be a generalist after 5 years.
This is kind of joining a pattern among other specialties of obstetrics gynecology being kind of a 2-in-1 specialty. We call it OBGYN, but really there's like the baby delivery parts and there's the women's health part of things.
Right.
Similar to hematology oncology being, well, blood and cancer.
Absolutely.
Yeah, and many others as well. So yeah, very exciting and like very good to hear that there's so much color within the types of medicine that you can practice in OBGYN, whether it be if you want to specialize in more of the surgical side of things or the medical side of things, as you did, where I think you did some your MFM or maternal fetal medicine training in the UK.
Yes.
Yeah.
So I trained in United Kingdom, where I got my we call it membership. Then I became a fellow. So after that, I did maternal fetal medicine as a special interest. And that was for 2 years before I emigrated to Canada. So I had to do the whole residency at the University of Toronto. So I don't think there was enough time again to go back and do another fellowship in maternal fetal medicine because I was no longer a spring chicken. So I decided to be practicing as a generalist. But my experience from the UK and the training enables me to do other things in addition to being a generalist. So I can do ultrasound, Dopplers, amniocentesis. So that experience has not been lost. And having repeated the residency program, I think it just made me even better in everything, right? So yeah, so that's my path.
Wow, you have a lot of experience under your belt.
I do.
Really, a lot. Yeah. And so delving more into like your role as an OBGYN doctor, being a generalist, but also having these like specific skill sets, like you talked about amniocentesis and ultrasounds and stuff. What does a typical day look like for you?
A typical day, for example, we do a lot of things. That's what brings color to the profession. But let's assume I'm going to be operating tomorrow. So for me, the typical day starts the day before, where I look at those cases, make sure I'm on top of my game. I know who is coming and what they're coming to do. In fact, I leave my bag at the door so that I don't waste so much time. Then, I also have learners. So in the morning, we meet the patient, usually in front of the operating room, introduce ourselves, and we escort that patient inside. And we do the surgical safety checklist, which is a teamwork and includes anesthesia, everybody. So, and the patients too, to make sure they understand what we're doing, confirm the surgery, and then we get started. So during that time, my role as the most responsible physician is to have a calm environment. Make sure everybody is included, understand where things are, where we're going. If things, if we're not sure about things, we all usually restock. But typically the day usually goes well with all the planning. We do the documentation, and then I'm ready to go home at 3:30. I go on the highway, get home, and start the home problem too. So children, husband, food, and all that. So in between those, if I have meetings, I'll try to catch up with those meetings. After dinner, believe me, you start preparing for the next day. And because of the electronic medical records, there's really no excuse not to prepare for the next day. So you can see how your life evolves around your work as well. But you have to make a way to make it interesting. So while I'm cooking, I'm also on the EMR. So that's usually a typical day. And I must say, it's usually very satisfying. I set goals, and at the end of it all, I look, have I met all those goals? Most times, yes.
Wow, you get a lot done in a single day.
Absolutely, Cameron.
Yeah. And the way that you talked about your dedication to making sure that like every OR is preceded by you reviewing the cases very well so that you feel like you can coordinate the care as best as possible,
Right.
and also making sure that everyone on the team understands the patient, the learners, like me, I might be in your OR if I was a medical student. It's really excellent to hear that you have that dedication.
Thank you.
I can just tell by like the way that you talk about it, your patients must love you. They really must love you.
I love them too.
What would you say is a case that encapsulates what brings you joy on a daily basis being an OBGYN doctor?
So if you think about, you know, mostly surgical, for example, when you're doing fibroid surgery, fibroid is a tumor that affects women in their reproductive life, and they could be very, very big. So you can imagine thinking that someone is about 9 months pregnant, but it's not a baby, it's a fibroid. So trying to get those things out in a way that you have a specific technique that takes into account minimal blood loss, and having a trainee there who sees what you've done and they go, oh my God, this is so nice. That makes you look like a genius, right? But obviously not. So it's very satisfying that you've done this and it's going to impact positively the life of that patient. I think that's probably one area that I find joy and you have minimized all the risk as much as possible, avoiding blood transfusion, making sure that that patient is prepped for surgery. I see that as instant gratification. The other one, of course, is doing cesarean section, which we do a lot. With the baby coming out and suddenly the whole room turns into a roar of laughter and you drop the drape, the mother sees the baby, the dad does skin to skin. I think it just gives you that instant joy. And that's, delivering babies is one of the profession where that gratification is instantaneous.
The baby is out, and then everyone is happy.
Everyone is happy, including yourself. So you can imagine how many laughter in a month just delivering babies. And same thing, if it was a C-section, if it's vaginal delivery, the baby is out. You wait for that baby to cry. The baby cries and everybody just say, oh my God. So that's one aspect of OB-GYN that I think I will not trade for anything.
It's a unique specialty in that way where a routine part of the job is you get to celebrate life dozens of times a day.
Yes, yes.
Yeah. What would you say on the flip side are some of the more challenging aspects of your job?
Well, there are, because every good thing must have a bad part of it. And I think it's important for people to understand that being in medicine, it's not a cakewalk. There will be times where things could be challenging, but how do you not internalize that? Look at the pros and cons of what you do. I've talked about the joy, but of course there are going to be areas that we're not always comfortable with. And that's why it's important to be well trained. And being a medical student here, being a resident, you will be well trained. So people talk about the litigation. Yes, it's important, but you have a lot of resources to minimize that. Not that you're not going to get one or two in your career. Of course you would, but at least you would have done whatever is possible to mitigate that. Then the other thing is work-life balance. I must tell you, indeed, it is true. The nights are long. If you love your bed, it's hard. So you can imagine being woken up in the middle of the night and you say to yourself, this is the best thing that has happened to me. That's the kind of mindset, because working in the night it's not fun for anyone. And if you're going to OB-GYN just for what you get paid, it's not enough to compensate for that. And also the gender pay gap is something else as well we're not going to talk about. So how do you balance the long hours, the nights, with work, with children? So it is sacrifice. So you will need support system in place. Families are very important. Can somebody pick up your child when you're running late, or make adequate arrangements? So, and I also think that for those of us who have done it, who have seen the profession when it was very difficult, our role is to advocate for the people coming behind us to make it more pleasant, to make it more humane, to do the job. But I think by and large, even in the grand scheme of things, you can still try to balance those things and have mentors to help you navigate some of those spaces. And I have used those in the past, and I am always very happy to mentor those people coming behind me and finding a way that they can enjoy it and still be able to care for their loved ones at home.
You have no idea how happy it makes me as like a medical learner to know that there's mentors out there like you who are invested in making the training system a better place for everyone going through, like recognizing the real sacrifices that you have to make as like a human, as a mother, as a father, in going through your training.
Maybe you change from internal medicine to a big guy.
I could do both, yeah.
Oh yes, after you can, yes, for sure.
Something else that you said that really resonated with me was like one of the foremost things of the challenges of medicine is one of the foremost things in the challenges of medicine are the things you have to learn to be an excellent physician. And it is a tall order because it's such a privileged position that we have. It's kind of an increasing realization I had over my clerkship to realize, like, oh, I should know all of this because there is someone who needs my help. And this is what I want to do for them. And I need to know how to do that.
Right.
So yeah, it's a really, really great lesson that you said that
Yeah.
resonates well with me. Um, yeah, and so I really like talking about your job as an obstetrician gynecologist.
Right.
You also have this such interesting leadership position as the inaugural president of the Black Physicians of Canada. Could you tell me a little bit more about that?
So this organization was actually started at the wake of the death of George Floyd, which the whole world suddenly realized that we needed to do more. And the organization was founded by learners like you, two learners, Dr. Ehadi and Dr. Semalulu. They were residents. They founded that organization and I was the president. And the organization was to support, unite, Black learners and also Black physicians who are within the Canadian healthcare practice. We know that, there are issues that we needed to address. Underrepresentation was one of it, and also the experiences of Black patients within the Canadian healthcare system. So I led that organization for 4 years, and I just became past president in October. During that time, it was very interesting because not only did I learn a lot of things, I think I also taught a lot of things as well. There was opportunity to partner with organizations like the Royal College, the SOGC, Canadian Medical Physicians Associations, the CMP, and a lot of organizations to see where we can partner together, where we can address some inequities within the Canadian system, be it in medical education or even with the patient experiences. So we're now in a position that the organization has taken more shape and we're now doing a lot of work in those aspects. So even in this context within the AFMC, we have presence in that. So we also work with organizations like Indigenous Physicians Association of Canada. So it's a lot of work, which I enjoyed. And like I said, I learned a lot during my presidency. And those learnings have continued to shape what I do and also how to make things better for learners who are underrepresented within the medical education.
And I can imagine that, like, the lessons you learned
Yes.
as the past president of the Black Physicians Association of Canada also make it into how you care for patients as well. I'm sure there's so much about the healthcare
Yes.
system. Very cool to hear about how many organizations you collaborated with your own organizations. Must have been a very busy job for sure. But you must have learned so much about, like, what you can do for Black patients, for Black physicians, Black learners as well, within the system that we have. So yeah, I would have loved to talk to you like for an hour about that, but we only have a short amount of time, unfortunately. But very, very neat. And your role as the president-elect of
Right.
the, could you say it again?
Federation of Medical Women Council. So my role now, you can say, going into another intersection, right? So now it's in the world of women or those who identify as women. So that organization, actually, we have a lot of learners in it too. So we advocate for women's care, reproductive rights and justice, and also things speaking up against gender-based violence. We were just at United Nations about a couple of weeks ago, and we had the opportunity to meet with other organizations around the world and also have our own parallel events where we talked about reproductive rights and justice. So this organization I'm very passionate about. How do we advocate for women and also women care as well. Because if you think about other professions, not because I'm just an OBGYN, but there are areas of inequitable access to women's care. I think the one that usually resonates with me, it's the care of women undergoing miscarriages.
Mm.
And miscarriage is so common. It affects 1 in 4 women. 85% of that miscarriage will happen in the first 13 weeks when women do not have access to their healthcare provider. What do? 4 out of 5 of them will end up in emergency departments where the wait time is so long before they get care, waiting for ultrasound. So those kind of inequities, I think we're not addressing them. So I'm hoping that my role as president of Federation of Medical Women Council will address those things. Also, the disproportionate effect of maternal mortality and morbidity in some equity deserving community. We don't have the race-based data, but we know that most of these things are mirrored in any of these high-income countries. So we want to shine light into those things, as well as gender-based violence. So there's a lot of work to do, and I haven't started. So next year will be my presidency. So
Well, yeah, I'm sure you will be an excellent president. I really tell you care so much about these issues and how they impact women. I'm I'm very looking forward to your presidency and seeing what you can do for patients.
thank you, Cameron.
Really. Yeah, it's been an excellent conversation speaking with you about your job and your passions for advocating for patients and for learners as well. In wrapping up this podcast, I wanted to ask you, as a takeaway and maybe also a reflective piece, if you were to go back and tell your past self, maybe back in medical school or early in residency, a lesson that you've learned now, what would that be?
Well, for my past self, I'm happy I chose this profession. So if I were to be born again, I'll go back to it. However, I think early advocacy is something that I think we should all do, and not only advocate for ourselves, advocate for people who do not have the voice. And you don't have to leave your country to do that. If you go to downtown Toronto, you see people who are homeless. So how do we use our privilege, being medical students, being physicians, to tell the story of others? I started late, or maybe I was doing it and it wasn't so obvious, but I think we need to be passionate about. So I think as any student, take the opportunity, take your privilege, use it, because it's a talent that you've been given and you just don't want to take it for granted. So that's what I would say.
Super valuable lesson. And well, I'm sure if any medical student like myself looked at your biography, which is so long and so rich and full of experiences, I think anyone would guess that you have been doing advocacy for so long, and at the very least, you are so passionate about it. So, very valuable to take advantage of the privileged position of being a physician and to use it to uplift
Others.
people. Yeah, exactly. Well, it's been a real pleasure to speak with you, Dr. Tunde-Byass.
Thank you so much, Cameron. And I'm not sure if I've convinced you to come to OB-GYN again. Thank you so much. It was so lovely to talk to you.
Yeah, maybe I'll end up being in obstetric medicine, which is possible from internal medicine. It's possible.
Wow.
Yeah.
That would be great. I'll look out for you.
Yeah.
Thank you so much.
Yeah. Well, thank you so much for tuning into this episode of the Specialty Cafe, for the really, really enchanted experience and chance to chat with Dr. Tunde-Byass. If you are a resident in a Royal College affiliated specialty, remember to join as a resident affiliated member. It is free. And we'll see you on the next episode on the Specialty Cafe. This is Cameron Wong. Thanks so much.